Welcome back, everyone, to One Senior Source Utah Radio on 860 AM, Utah's Big Talker. I'm Michelle Rowley.
And I'm Dennis Rowley. And one of the things that I know is a big issue, and it's not just for seniors, but pretty much for if you're a human being, you're going to experience pain. And we have on the phone with us today Reagan Archibald. Reagan is with East West Health. And how are you today, Reagan?
I'm doing great.
Good. So one of the things that I know that you do there is pain relief.
Of course, yeah. We do treat a lot of pain conditions, back pain, neck pain, headaches, using natural solutions.
Hey, well, I know that Michelle has a pain in the neck, and it's standing right across from her right now, recording a radio show. But we won't talk about that now. So talk to us a little bit about some of the pain solutions that you have.
Well, there's several things we do. One of the major areas where we get great results is with headaches. So that could be migraine headaches. We recently had a patient who was suffering from ocular migraines who were able to help resolve those. But we take a threefold approach with headaches. One thing we look at are what the triggers are, and so a lot of those triggers could be related to food or more specifically how your immune system reacts to food. So we do different food testing and then put patients on a proper nutritional protocol. The other thing that we found that triggers a lot of the migraine headaches are hormonal fluctuations. So we've got one of the most comprehensive hormonal tests that we give to our patients, and it's a questionnaire, so it's easy, and it helps us isolate which part of their hormonal system could be out of balance. And we have found that allows us to determine if there's actual need for some kind of blood or saliva test.
Now that I find that really interesting. That two of the major causes of migraine headache are food and hormone.
Correct. Yep.
So if someone's been having a headache for, let's say, how long, would you recommend that they would be in a good position to come in and talk to you?
80% of us will have a headache this year, at least one day out of the year. If you have a headache, more than once every month, then that's not normal. It's common for people to have headaches, but if somebody suffers, if you have a headache, even if it's once a month, then absolutely come get it checked out, because most symptoms tend to get worse over time if they're not corrected.
And do you find that's often a symptom of maybe another bigger problem that needs to be addressed?
Exactly. Yeah, it's just like the check engine light that comes on in your car. If you ignore it for long enough, then pretty soon your car is going to break down. So, you're exactly right, Michelle.
Okay.
So bring it now. Another big problem that I know a lot of people have chronic pain with is the back.
Correct. We've combined a very comprehensive treatment for back pain, and it can be if a person's got stenosis, which is the narrowing of the channel that the nerves of the spine run through. We treat degenerative disc disease, disc herniations, and we use a combination of trigger point therapy, trigger point injections. We use a little bit of lidocaine in the injections, and then a substance called Serapin, which is a more natural anti-inflammatory agent. And then we combine that with a 3,500-year-old medicine called acupuncture. And acupuncture has the ability to promote better blood circulation in the back. It also helps change the way that your pain response is reacting with your brain. So we change the ability for your brain to produce more endorphins and serotonin so that your body can relax relax and recover.
So basically what you're saying then is that it's not just simply taking a pill, or it's not a one solution approach.
Exactly. Yeah. What we find is, the human body is so complex, and we only know a little bit about it. So we definitely need to take a multidimensional approach to health conditions. Absolutely.
Well, and I'm sure you've seen some amazing things from the beginning of when someone first comes in to see you to when you've been going down one of these paths of working on headaches or backaches or any of these different things.
For sure, yeah. We've seen some fairly dramatic cases. In fact, we had a patient who had a fall. She was a rock climber, and when she first started coming to me, she emailed me and she said, "I don't like doctors, but I've heard good things about you. My friends rave about you, and I'm willing to come in, but I just want to let you know I don't like doctors, and I'm skeptical." She came in a wheelchair, and her name's Laura, but now Laura is able to walk. I mean, within about 3 months, we got her out of her wheelchair. She still has a walker because she had some pretty irreparable damage, but her energy levels are better. She's walking better. She's talking better. We were able to get some what her doctors consider miraculous results with our treatments.
That's tremendous. Now, Reagan, how can someone reach you, either on the web or by phone?
The best way to reach us is, you could either call 801-582-2011, or you can find us on our website, which is acueastwest.com.
Okay. Well, thank you so much, Reagan. That was tremendous information. I know that what you do can help a lot of people. Now, if you were not able to get Reagan's information there, you can call us at 844-981-0099. Again, that's 844-981-0099, or email me, dennis@oneseniorsource.com, or go to the website, which is oneseniorsource.com.